Let us now start with the very important diseases of nose and paranasal sinuses, and the first disease that we'll be talking about is something called as choanal atresia. Choanal atresia is the first disease that we'll be starting in this particular concept and topics of nose and paranasal sinuses. To understand choanal atresia, first of all, in fact, I have to make you recall what was choana. If you remember, choana was the junction where the nasal cavity ended and nasopharynx started. The junction between the nasal cavity and the nasopharynx is basically called as choana. Fine. Now listen to a proper clinical case very carefully, and by just listening this proper clinical case, you'll understand this disease called as choanal atresia. I'll take you inside the exact labor room, and a child is getting delivered. See, mother is lying, child has been delivered, obstetrician and gynecologist is present over there. The child has been delivered along with obs and gynae. Pediatrician is standing, and pediatrician, checks that particular child for all the important vitals and everything. Immediately they find that the child is basically turning cyanosed. Cyanosis is occurring in this particular child. Why is this happening? Whenever cyanosis happens in a child that has been born just right now, first of all, the pediatrician tries to rule out all the cyanotic heart diseases cases. Fine. After ruling out that these cyanotic heart diseases cases are actually not present in this particular child, what they'll do, they'll call an ENT also. Along with that, they'll do something to check whether the child is having choanal atresia or not. Fine. What will happen is, I'll also enter inside that particular area. I'll see that the child is turning into particular thing that we call as cyanosis. Child is turning blue, child is getting cyanosed. I'll put a very small bore sort of a, called as nasogastric tube. I'll put a nasogastric tube inside the nose of the child. As soon as I try to put that nasogastric tube inside the nose of the child, I'll see that this particular tube is not going beyond. Why this particular tube is not going beyond? Because it is getting stopped at the level of choana. You remember, after the nasal cavity, choana, and then nasopharynx starts. Nasal cavity, choana, and the nasopharynx starts. When I had put this nasogastric tube inside the nose of the child, it was not going beyond the choana. It couldn't go to the nasopharynx. Fine. Sorry, I want to ask you one thing. If both the choana are blocked, child cannot breathe from nose? Yes, sir. This is the reason why the child is turning cyanosed? Yes, sir. Child could have opened the mouth, but a newborn child is an obligate nasal breather. Remember that. A newborn child is obligate nasal breather. Remember this particular fact. A newborn child is obligate nasal breather. They actually don't know that we can breathe from the mouth also. Fine, like we people are adults. Whenever our nose is blocked, we can breathe from the mouth also. But a newborn child does not know that he or she can breathe from the mouth also. They only know that they can breathe from the nose itself. Now, after putting that nasogastric tube, I am confirmed that this child is having choanal atresia, or basically bilateral choanal atresia. Basically what? Bilateral choanal atresia. Now, sir, what you will do? Sir, for immediate relief, I can put something inside the mouth of the child so that the mouth remains open. Yes, sir. But sir, I also noticed one very important thing. What? As soon as I tightly pinch the skin of the child, or I made the child cry, how the child cries? Child will open the mouth and take a deep breath. Child will open the mouth and take a deep breath, and then the child will start crying. As soon as the child does this particular thing, cyanosis disappears. Why? Because the air has entered inside from the mouth. That is why we say that as soon as the child cries, Cyanosis disappears. Cyanosed blue baby turns pink while crying. Cyanosed baby turns pink while crying. But will you make the child cry the whole day? No. You'll put something inside the mouth of the child so that his or her mouth remains open and the child can breathe from the mouth itself. And that is basically called as, remember that, very important MCQ it is basically called as McGovern's nipple. Very important MCQ asked in all examination platforms, whether it's NEET-PG, INI-CET or FMGE examination, that McGovern's nipple is put inside the mouth of the child so that the mouth remains open and child can breathe from the mouth. Cyanosis disappears. Can you do something ahead to get, in fact, to give a permanent relief to this particular child? Yes, sir. What I'll do is, I'll do one very important thing. I'll take the child for a basic surgical procedure. I'll use either endoscopic dilatation or laser and remove that atresia part. I'll remove that atresia part. I can use either endoscopic dilatation or laser. That does not matter. But the final question is, sir, why did this particular thing happen? It happened because it is a proper congenital problem. And what is this congenital problem? It is persistence of bucco-nasal membrane. It was the persistence of the bucco-nasal membrane during the time of development. Persistence of bucco-nasal membrane leads to something called as choanal atresia. Bilateral choana, both side choana, if involved, is a sort of emergency. Child will turn cyanosed. Remember that. Unilateral choanal atresia is not an emergency because at least one nostril or one choana is open. But bilateral choanal atresia is a problem. In case of bilateral choanal atresia, we see that cyanosis disappears as soon as the child cries. For proper breathing of the mouth, we have to put something called as McGovern's nipple in the mouth of the child and the cyanosis disappears. Further, we can take up the child for a surgery like endoscopic dilatation or laser techniques, remove that bucco-nasal membrane part, remove that choanal atresia part. The child will lead a normal life. And this particular thing is basically called as choanal atresia. This particular disease you have to remember.